Hi, my name is Destiny, and today I'm going to be talking about my internship experience at Humble. So, I was in the Portland location, um, and just some basic information about the site. There is a gym area with all of the gym equipment, bikes, treadmills, um, dumbbells, squat machine, leg press, basically any type of equipment that you can think of that would be at the gym. Um, then there's also a pool, which is really nice because not a lot of places have a pool on site, and the patients really enjoy it because it's always heated, and at the end of their exercises, they get to relax with the jets on, so they look forward to that. And then in the back are the treatment rooms where they get all of their treatments. So there is 2 physical therapists and 4 assistants, and probably about 15 technicians. I was overwhelmed with the amount of people that were there at first, especially because we would get like over 100 patients a day. Um, really like closer to like 150 a day, but I did like that the day would go by so fast, and it's not the same patients every day or the same type of patients. There were geriatric patients, children, high schoolers, athletes, really just a variety of patients that go in, so that was really nice. Getting to work with different types of patients. I got to work with a little girl who was like 5 years old, so that was pretty cool. Some of the things that I would do is basic things like cleaning, making sure that the gym is always organized and clean, ready for the next set of patients. Making sure that there's not anything blocking the patients, especially if some of them already struggle walking on their own, making sure that there's nothing that they're gonna slip on or things like that. On slower days, we would do more like deep cleaning, vacuuming, sweeping, dusting, anything that you can think of, just clean. There was a lot of training, learned how to do ultrasounds, setups with the electrical stimulation machines, and also traction, which is like a light tug. So that's why I have these pictures here. There's me getting an ultrasound on the elbow, and the one above that is me getting a electrical stimulation setup on the knee, and then the bigger one is me getting set up on pelvic traction, which is like used for patients with lower back pain or injuries. And then after all of the training, after learning all of the exercises, all of the stretches, all of the different types of treatment and how to do it, how to set it up, then they started letting me do more hands-on experience with the patients and guiding them through their exercises. So my favorite experience is whenever one of the patients was graduating, so to speak. It was her last day there, and she was just so grateful for everyone's help, for everyone always being so kind to her, and taking our time to help her through her recovery. So she made cookies for everyone, and she gave every single technician, every single PT, PTA a hug goodbye. It was very sweet and a very special moment, and I just felt appreciated, and it was just by far my favorite day out of my internship. One of the most challenging things for me was whenever I was being trained, we would have these checkoffs. So one of the people training me, whether it was a PT or a PTA or a technician who had been there for a while, they would ask, okay, do you feel confident? Do you feel like you know everything in this area of the gym or the treatment rooms or the pool or whatever? And if I said yes, and they'd be like, okay, well, we're gonna test you, we're gonna check you off on what you know. Otherwise, you can't do this on your own. You have to be under supervision. And then they would ask like scenario-based questions. So like if the patient says this, how do you respond? Or if you are trying to target this muscle to be engaged, how would you modify the exercise? And so that was pretty challenging for me, even having my education in kinesiology and anatomy and all of that. It's like I would know the answer, but I just wouldn't feel confident in it. And if I had even just the slightest bit of I'm not sure, then they'd be like, okay, I'm not gonna check you off. So that was pretty nerve-wracking for me. What I would do differently, with that being said, is just being more confident, knowing that I've been taught what I need to know, and I just need to use that knowledge. Being able to think quickly on my feet, and I would just communicate better with everyone, my coworkers, my trainers, my supervisor, just everyone, and asking questions so that I can go in knowing what I have to do and how to do it without any hesitation. So that's pretty much it. Thank you.